Alright, this is the thoracic and cervical spine evaluation practical. To start, I will go with the, excuse me, I'll go with MAPSO, so mechanism of injury, acute chronic, pain, past history, signs and symptoms, sounds, and other. And then there is inspection or observation. As you always have, there's observe for deformity, discoloration, and swelling. Then you'll look for other things you'll look for would be uh, weak neck with the neck flexed forward, um, winging scapula, protracted shoulders, scapular level, and then the level of the sternum. And then you'll also look for posture, specifically observe the patient's uh, kyphosis, lordosis, and scoliosis. And then for scoliosis, you'll look at structural versus or if it's functional scoliosis. That's all for observation. Then next we will go to next we'll do palpation. So first thing you'll palpate is the hyoid bone, thyroid cartilage, cricoid cartilage. Alright, and then you can take your shirt off and you can face that way. Or go on the other side of the Okay, so this would be the cervical spine region, thoracic spine region, and then the cervical vertebrae, and here would be where the cervical spinous processes would be, and then here's where the thoracic spinous processes would be. Then there is the scapula, and then there's some landmarks to take into account to help you kind of have an idea of where you are on the spine. So you'll take the superior angle that's lined up approximately with T2. Then you'll take the spine of the scapula, which lines up approximately with T3. And then the inferior angle of the scapula, which lines up approximately with T7. And then there's a ligament that runs all the way down the cervical spine and thoracic spine all the way to the bottom, which is the supraspinous ligament. It's one long ligament that goes all the way along where the spinous processes are. That's it for the bony structures. And then for muscles, there's the levator scapulae right here, the latissimus dorsi that go down here. Then there's the upper, middle, lower trap. Then beneath that there is the rhomboid major and rhomboid minor. Alright, we can put your shirt back on. Alright, let me sit right here. So now we'll do the ranges of motion. And so for range of motion, I'll start with active range of motion. And first one I'll have you do is cervical flexion. So just bring your chin to your neck, perfect. Then I'll have you do cervical extension. Bring your head back like that, good. Alright, now I'm going to have you bring your right ear to your right shoulder. That's cervical lateral flexion. And have your left ear to your left shoulder. That's cervical lateral flexion as well. And then I just want you to rotate your head to look to your right and to your left. That is cervical rotation for active range of motion. And then I'll have you stand up for this one, for trunk. Have you stand up for me. And then just bend over at your waist. Good. That's trunk flexion. And then just bring your back. Good. Alright, you can sit down for me. That is trunk extension. Alright, and then for passive range of motion, I will start with trunk, or not trunk, I'll start with cervical flexion, just like that. And then that was cervical flexion. This is cervical extension, cervical rotation, and then cervical lateral flexion. Good. Now I will do cervical or resist range of motion for all the movements. So first one I'll have you do, bring your head back for me. And then this is resist range of motion of cervical flexion. Keep going all the way. Push as hard as you can. Good. And just keep your chin right there. Now this will be cervical extension resist range of motion. All the way back. Good. Now I'll have you push your head to your right ear to your right shoulder. This is resist range of motion, cervical flexion. The other side. Good. And look to your right. Have you look to your left now. Good. Keep looking that way. Push this way. That would be resisted range of motion for cervical rotation. And now I'll have you lay back for me. This will be resisted range of motion for cervical, not cervical, for trunk flexion. So just push up, do a crunchy. More. Okay, good. And flip onto your stomach for me. This would be, so the last one was trunk flexion. This would be a resisted range of motion, trunk flexion. This would be resisted range of motion for trunk extension. Push against all the way as hard as you can. Good, you can relax. Alright, you can sit right here for me. Alright, and now I'll do the manual muscle test for rhomboid, major, minor, and then the trapezius. So I'll bring the shoulder back, tract it. Bring your arm back, just shoulder back. Just like that. Okay, don't let me push it forward. Good. So that was the manual muscle test. Now we will do we'll do circulation. So to do circulation, I would just check skin color and temperature around the neck region and thoracic region. Make sure it looks good skin color and not any, and make sure that it's not clammy. Make sure the temperature is good. And then for neuro, we'll start with the dermatomes. So, alright, C2, I Actually, I'll have to take a shirt off quick. C2, C3, C4, C5, C6, C7, C8, T1. Alright, and now I'll have you shrug your shoulders up for me. This is shoulder ab. This is myotomes now. Last dermatomes. This is now myotomes. This is shoulder abduction, C5, and you would hold all of these for 5 seconds. Push down. Good. 5. Alright, and then C6 is elbow flexion. Right here. Don't let me pull this down. So C6. Good. Now you can extend your elbow at good. Nope, not right here. Just don't push it that way. C7. Keep your arm closer. C7. Then C8. I'll have you make fist. Don't let me pull your hands or your fingers apart. C8 is finger flexion. Good. And abduct your fingers. Good. This is T1. Okay, good. Now I'll do the reflexes. So the first one I'll have them do is the brachioradialis. I'll hit right here. Good. And then if I had a reflex hammer, that was the brachioradialis reflex. This is the biceps brachii. So I would find the biceps tendon, and then I would take a hammer and hit my finger over the biceps tendon. And the last one, relax, keep your elbows straight. Relax. Okay. Now the triceps brachii reflex. Find the triceps tendon. Then strike that. Good. Make sure I got everything done besides special tests. Alright, you can put your shirt back on. Alright, now we are on to the last part with special tests. Alright, I will have you laid back for me. Keep your head on this for now. First test I'll be doing is beaver sign. This test is testing for thoracic nerve inhibition. Positive sign would be the umbilicus moving to one side or moving up or down. I'll just have you lift up here. And so I'll be watching the umbilicus, and he'll just do a crunchy for me. Good. And again, positive would be if the belly button moved to one side or moved up or down. Then come off the edge a little bit. This is the vertebral artery test. This is testing for vertebral artery occlusion. Positive sign would be nystagmus, unilateral pupil difference, dizziness, nausea, confusion. And the test goes back. Keep your eyes open for me. Be watching his pupils. You'd hold this for 30 seconds, and you'd do it to both sides. You can scoot back a little bit. Keep laying down for me. And then we'll put this here for you. The next test will be, the next test is the Babinski's test. Let me grab a pencil. Best I can do is a battery, but so you'd use an object. Babinski's test is testing for it's a testing for upper motor neuron lesion or spinal cord trauma. And then positive sign would be if the great toe extends and the rest of the toes splay. And then the actual test is just like that. All right, and you can sit up for me, Dad. Next test I'll have him do is the Valsalva test. So for Valsalva, it's testing for thecal or intrathecal pathology. Positive sign would be pain in the cervical spine or pain that goes down the arm when doing the test. So, yep, so I'll just have you blow in your hand and act like you're trying to pass a bowel. Perfect. All right, and the next one will be the first thoracic nerve root stretch test. So for this one, just have your arm out to the side, bring it in like that, and then touch behind your neck. And then positive sign for that would be pain below the scapula or pain that goes down the arm. And that's testing for first thoracic nerve root mobility. Okay, perfect. And the next one will be the cervical compression test. This is testing for cervical nerve root compression or facet joint pathology. So go down like that. Positive test would be pain or reproduction of symptoms, pain in the cervical spine or that goes down the arm, or reproduction of neurological symptoms. Then there is the cervical distraction test. So for the cervical distraction test, you're testing for cervical nerve root compression or cervical radiculopathy. Positive sign would be relief of pain or symptoms or decreased pain or symptoms when doing the test. So there's that. That was that test. And then there is the Sperling's test. This is testing for nerve root impingement. Positive sign would be pain that radiates down the arm or reproduction of symptoms. And for this, you bring them into extension and then lateral flexion, airlock. Good. And something I didn't qualify before doing this, the test that you go to one side, you would do, so like the vertebral artery test as well, you would do it on, or the first thoracic nerve root stretch test, you would do it on both sides, starting on the good side, then working to the bad side. For the test, we'll just be demonstrating the one side. So that's Sperling's test, and then one thing to also note for the Sperling's test is if there is any pain with cervical extension, don't continue with the lateral flexion and the downward pressure. Then there is the brachial plexus traction test. This is testing for brachial plexus trauma. Positive sign is sharp radiating pain. Also, there's two different types of positive tests. So the test itself is like this, and if they're having a brachial plexus tension injury, this side would be what is having pain, and if they're having compression injury, this side would be the one causing pain. Okay, now we are on to the Allen test. So this is testing for thoracic outlet syndrome, and positive sign would be disappearance of radial pulse or reproduction of signs and symptoms. And have you look to your left? Good. Then the next one is the Halsted maneuver. This test is also testing for thoracic outlet syndrome. Positive for Halsted maneuver would be a disappearance or a decreased radial pulse. Look the opposite way. Good. Alright, that was the Halsted maneuver. And the next one is the Adson maneuver. The Adson maneuver is also testing for thoracic outlet syndrome. And then a positive would be a reproduction of signs or symptoms or a disappearing or decreased radial pulse when compared bilaterally. And the test itself. And then when I do this, I want you to look towards me and take a deep breath in and hold it. Okay. Alright, good. Then there is the, bring this over here. Right there. This is the military brace position. This is testing for costoclavicular syndrome and other thoracic outlet syndromes. Positive test for this would be reproduction of symptoms, neurological symptoms, or disappearance or decreased radial pulse. Good, and then I want you to bring your head all the way back as far as you can. Good. And then the final test is the Ruse test. So this test is testing for vascular or neurological thoracic outlet syndrome. Positive test would be unable to perform the test for 3 minutes, or reproduction of signs or symptoms. So just have your arms up like that, and then close your hands as fast as you can. You would perform this test for 3 minutes, but for this video, we will not perform it for that whole time. And with that, that is the end of the cervical and thoracic evaluation practical.